different levels. You may remember at the end of last month, the Prime Minister called out for Canadian businesses to retool, to produce, to help to create a Canadian stockpile of PPE, that personal protective equipment that is unfortunately in short supply and that is critically needed by Canada's doctors and nurses and frontline healthcare workers. And he came forward with a $2 billion funding commitment. Some of the money went to a team that you're going to learn about right now, and you're going to love their story. I think Mitch DeBora, who is the CEO and co-founder of Mosaic Manufacturing. He's right there in the middle. Hello, Mitch. Nice to have you on the program.
Thanks. Hi, Heather. Good morning.
Good morning. And Shelby Yee is with us as well, the CEO and co-founder of RockMass Technologies. And morning to you as well, Shelby.
Morning, Heather.
Okay, you get to start, Shelby. What does your company, what does RockMass normally do?
So RockMass is typically a hardware and software company that produces data collection solutions for the mining industry.
For the mining industry. Okay, and what about you, Mitch? Tell me about Mosaic Manufacturing and your usual product.
Yeah, so Mosaic Manufacturing is in the 3D printing space, and we're working to scale 3D printing into mass manufacturing. So pretty relevant to what we're doing now.
Yes, because we'll see how you've put it into place. So Mitch, then let me continue with you. The Prime Minister puts this call out. Pandemic has shut everything down essentially, and there is money available for companies to help. And then what did you do? What have you done with you and Shelby and your little network?
Yeah, so within the network, we understood the sort of imminent demand for a really large amount of PPE, more than we could possibly have time to set up manufacturing anywhere else. So we set up a network of 3D printers, 21 different locations across the city so that we can have physical distancing and ramp up to make 50,000 face shields, which are what healthcare workers will wear over a mask. It looks something like this. And this is used to protect the eyes and the face.
So, all right, so then, so many questions. Let me go back to Shelby, though, because I want to make sure that I talk to both of you. So then how does RockMass fit in with this, Shelby?
Yeah, so with the onset of COVID-19 and seeing a little bit of decreased demand on our side, we immediately said, okay, how can we help? We have this team of really talented and skilled engineers, and being able to produce face shields with other tech companies specializing in manufacturing and medical tech was an obvious way that we could contribute.
So you're part of this You're two. We should probably mention as well, Shelby. Is it GLIA and ReDeTec? Is that right? Those are the other two, and you have money from the government to manufacture together. So then, so I understand this correctly. In your facility, are you one of the 21 places that is now making these face shields? You've retooled for this?
Yes, exactly. So a number of our engineers have retooled and are a part of the remote manufacturing approach, and we're able to continue to ramp up the total production capacity by joining forces with all four companies.
So come back to Mitch, if we could, for just a second and explain. I mean, you were already in the 3D space, the 3D printing space, but I've been always intrigued when you say manufacturers are retooling and can suddenly, car manufacturers or hockey manufacturers are suddenly making protective equipment for the medical sector. How do you do that? How do you retool?
Yeah, no, that's incredibly important. So a 3D printer is a really flexible piece of manufacturing technology. One day it's making parts for aircraft. The next day it's making, what we need today, which is PPE. I can actually show you. I have a printer here.
Yeah, walk us through the process. That'd be fantastic, Mitch, and show us how it's done and where it's done.
Yeah, so where it's happening right now is actually in my living room. Here's an example of a 3D printer. And what the 3D printer is doing is taking in a plastic material, it's melting it down, and it's forming the components of this face shield. It'll make one every couple hours, meaning that we can make about 50 a day on multiple printers. So we set these up in, again, 21 people's homes based on the constraints of COVID-19 right now. And together, using that piece of technology, we can switch from being a company that normally manufactures and sells 3D printer technology to being a company that's actually manufacturing components of the PPE. Again, 50,000 in a really short period of time. That's unheard of. That's never really happened before.
That is the target, the 50,000. And Shelby, what is your target date for when you will have created all of these and are going to be able to ship them out?
So we're in the stages of ramping up right now, and we are going to be able to ship 50,000, perhaps more, face shields by the end of June.
By the end of June, so that is pretty close. May, June, just a couple of months from now, 50,000 into the hands of the healthcare workers who need it. Shelby, I will come back to Mitch for a clothing thought, but I'd love to get Shelby's take on all of this. The process of transforming your business to answer a particular need at a time of crisis, how do you feel about taking part in this effort?
I mean, this is an incredible way for our team to remotely contribute and be part of this Canada effort. So for our engineers, they have the hard skills of being able to 3D print. So it's amazing that we're able to contribute and bring this effort at scale to Ontario and Canada.
And to you, Mitch, the same question. I mean, this is your space, but you're seeing this put into use in a very different way by a different customer or client, if I can put it that way. What are your thoughts about participating?
Yeah, we couldn't be prouder as a team. You know, things when the whole crisis started, things got a little bit disparate. There wasn't as much going on, but as soon as this happened, everyone came together. We feel really privileged that we sort of had the skill set that we could contribute meaningfully to make a difference. And we're just really glad that the Canadian government and the Engine program were able to step up so quickly and help us make this a reality. So we couldn't be happier to be part of it, and glad we can help.
And is this something that you think, Mitch, might be lasting, or is this just a measure for now and then you'll revert to your normal kind of work, or what are your thoughts? Perhaps this has changed the landscape.
Yeah, I think it certainly has. I think a portion of us will revert back to our normal work, but this goes much past making 50,000 face shields. We're demonstrating that in the time of a crisis, 3D printing can be used to scale up to solve a problem. This time it's face shields, next time it might be something different, but we're creating that blueprint that will last sort of far past the impact that the 50,000 face shields will have.
That's a really important thought, looking at that great picture. Mitch, Shelby, let me say thank you to you. Thank you so much, Shelby. And Mitch, thank you to you. But can you just show us around? It's quite mind-boggling for some people who haven't seen 3D printing in action. Just give us one last view of how it is in homes like that situation. 50,000 face shields are coming in just 2.5 months. Let's have that as our parting look. As I say thank you to Shelby and to Mitch. Show us your house again and show us that machine, if you would.
Absolutely,
there it is.
Here it is.
From those 4 companies in 21 different homes across the country, 500,000 face shields for the healthcare workers who need them so badly right now. Mitch and Shelby, again, thank you very much, both of them in Toronto today.